Okay, we're going to talk about the humerus now. And so this is the arm, the bone of the upper arm, and we can talk about a few landmarks on here as well. So again, very important to be able to tell left from right humerus. So a couple ways that we can identify left and right. This is the head of the humerus. So this ball part on top, this is the part that's going to articulate with the glenoid cavity of the scapula. And so the head of the humerus is always going to angle medially because the glenoid cavity is angled laterally and they have to be able to make a connection there. So head of the humerus is always going to face medial. If we look down at the distal end of the humerus, we see this side. This has got a small indention on the distal end. That's the coronoid fossa. We'll talk about that in a second. The posterior aspect of the humerus has got a much larger indention to make room for the olecranon process, which is a larger bony prominence. So this large indention is always going to be posterior. So if we put that towards the back and we angle the head medially, we can see that this is going to be a right humerus. Okay. So a couple other landmarks. On the proximal end of the humerus, we can see a couple bony prominences. So the one that is more superior and lateral is going to be the greater tubercle. And this one here, the one that's a little more medial and inferior, is going to be the lesser tubercle. Okay. You'll notice on your humerus that you've got a little sulcus or little gutter or groove running in between these two tubercles. So that is called the intertubercular groove or intertubercular sulcus, or even bicipital groove, because the long head of the biceps tendon is going to run through that groove. Okay. We can look a little further down the shaft of the humerus and along midline, along the diaphysis, we're going to see a raised bony area, and that's going to be the deltoid tuberosity. Okay, so that provides an attachment site for the deltoid muscle. And then at the distal end of the femur, we've got a couple landmarks. We've got these bony prominences on either end. The more pronounced one is the medial epicondyle. So we know that this points medially because this is a right humerus, and it's also more pronounced. So medial epicondyle is here. This would be lateral epicondyle. And the distal end of the humerus, laterally, we have the capitulum, which is going to articulate with the head of the radius, which is the lateral forearm bone. So it makes sense that it's going to be along the lateral aspect of the humerus. And medially, we've got the trochlea, which is going to articulate with the trochlear notch of the ulna. So above the capitulum, you've got a little indention that's called the radial fossa. So the radial head is going to move into there during elbow flexion. And more medially, you've got the coronoid fossa. And that's where the coronoid process of the ulna inserts when you flex your elbow. Okay. And then posteriorly, again, we've got this large fossa that you're going to find on the posterior side of the humerus, and that provides room for the olecranon process of the ulna to move into as you straighten your elbow.